A very good evening. All our lovely viewers are watching the Order Paper 256 on our YouTube channel and named still Order Paper 256. Earlier, today's morning, I posted that we are going to be having a doctor on this platform. We're going to be having a doctor on a panel, and is none other than Dr. Kristen, and he will be breaking down issues concerning or regarding anything. Because we have seen it indeed, we have been talking a lot of politics here on the platform, but we have to enlarge the spectrum and we speak even on other sectors. And now we are bringing to you a sector of everything with a medical personnel. Is none other than Dr. Kristen. Dr. Kristen, we are so happy to be with you on this platform.
It's my great
It is called the Order Paper. People that have been waiting for you because I had posted you earlier and I informed that we are going to be having a doctor on the panel. Doctor, today what we are having on our Order Paper as a question is a question that says, has the government of Uganda done enough to promote NFA standards of its people? Do you think the government or our Ugandan government has it played its role of building the NFA sector of Uganda? You as a person who is in this sector, who is a doctor, you must be having information which is vivid in order to quantify the statement or not even to quantify. So you can take it from there.
Okay, thank you so much, my senior comrade, for this wonderful opportunity for me to appear on this mighty show.
Thank you
The
for
Order
also
Paper
turning up.
256.
Yes.
And I actually implore all people to
watch.
subscribe, like, share, and comment, and keep on engaging, because it's a very wonderful show that is helping build ideas and shape the nation.
Thank you so much.
Uh,
for comment.
to begin with, I'm Christian Agumatini, and I actually haven't become a doctor fully, but I will be a doctor anytime.
Anytime from now.
Yes.
So we are just waiting for graduation,
Most
but now you are a
definitely.
practicing medical personnel.
Most definitely.
Okay.
That's
Then-
how we would sum it up, maybe.
Then it means we are with the right person to speak.
Probably.
So the question is, has the government of Uganda played a very the question is, has the government of Uganda done enough in order to promote NFA standards in Uganda within its people? Do you think that the government has played its role in terms of revitalizing the NFA sector, in terms of funding it? You as a person who is in that sector, do you think it has done its role, or
as an individual, according to how I see the efforts by the government to ensure that the health standards of Uganda at a globally recognized level, I truly do not believe that the government has done what is truly needed, what is actually expected of it. A case in point, when you look at the Abuja Declaration, where countries met and they discussed and actually came to a conclusion that 15% of the national budget, annual national budget of every country should be set aside for the health sector. That has not been effected in Uganda. The minimum should be at least 15%. But when you look at Uganda, for example, the 2024-2025 national budget, you realize that it was only 6.5%.
hold on there.
Exactly.
So during the Abuja Declaration, as you have said, it was 15%.
Recommended percentage.
Recommended percentage.
Exactly.
To every country that participated.
Exactly.
But for the case of Uganda, they have not fulfilled
exactly
to 15%.
Only 6.5, which is not even half of the recommended percentage share on the national budget.
I didn't know this, by the way.
Exactly. So that shows you how the government has not really done enough. However, we must give credit where it's due and say that the government is in efforts to build more hospitals. You can see they are building National Military Hospital, upgrading health center, health center 3s to health center 4s, upgrading health center 4s to district hospitals, and so many others. So
Yes.
what actually needs to be prioritized is not only the facilities, but also when we talk about the health staffing. To begin with, the health sector doesn't work in isolation. The health sector doesn't work in isolation. It works in collaboration with other sectors. Talk
Yes.
about transportation sector. Talk about security. So it implies if at all other sectors are also good, health sector will also be to a good standard.
Okay.
So if at all we start from up going downward, it implies if at all we go to a national hospital, talk of Mulago National Referral Hospital, Kawempe Women's Hospital, talk of Chirudi National Referral Hospital,
Yes.
they should have the necessary equipment, talk of the beds, talk of the laboratories, talk of imaging, anything that is needed in the medical field. Then you look at the staffing. It's not just having the people there, the specialists, the super specialists, the doctors, then the nurses, the midwives, ensuring that is the staffing that I'm talking about. So it is not only about the staffing, but also facilitating the staff to do their work
By giving them salaries in time.
exactly, giving them salary, not just salaries, but enough salaries, and actually giving them a very conducive environment to work.
Okay.
So back to our question, I believe that the government has actually not effected that
Of late.
exactly, because when I truly do believe, according to my recent research, the national staffing in the health sector must be around 40% as per the recommended. It could be around 40% as per the recommended. So that shows you a very big gap compared to where we actually need to be.
Wow.
There is still a very big gap in the staffing, also in the equipment that are provided at the national level. So the government needs to really do what is actually needed.
So you're saying if the government, so you're saying that government must put in more funds in the health sector in order to uplift
That is
the
very,
standards.
that is very true, because we need enough staffing, and you cannot just have people you cannot have doctors work with little or no pay.
Because
we need more intern deployment. We've always had a very big challenge where interns are not deployed.
and not even not paid.
Exactly.
Yeah.
They go 2-3 months without receiving their pay. So we need the government to do
So
the funding, and then
funding,
also the monitoring, of course.
okay, yeah,
Because even if you fund the health sector and then you don't
monitor.
that
do the
implies you don't do the oversight.
So
that brings us to the different arms of the government. If at all the funding is done, then the responsible people have to come up and do the monitoring, ensuring that they have to ensure that the money that has been put into hospitals is actually followed up, is not misused. So that is how the system will be brought to the recommended standard.
Okay. Thank you so much for that submission and even for providing information. One,
pleasure.
I have learned, and I think even our lovely viewers, they have got a chance to get to know that the recommendation, it is of 15%.
Exactly. We
But
expect
now,
it to be at 15%, but
at
we stand at 6.5.
At 6.5, and
That's true.
it was at 65% when you said during the year 2025 up to 2000. So from 2024 up to 2025.
Yeah, that is the national budget 2024-2025
on the national budget.
on the national budget.
So you think that health should be one of the priority?
Actually, you know that without health, there is no sector that can go forward. You remember the time when 2020, 2021, at the time when we had COVID.
Yes.
So that shows you
Everything was put on hold.
how paramount health is. You can talk of security, talk of sports, talk of education, but health must be the priority above all, because without health, then there is nowhere. There is nothing that can go forward. You cannot go to work when you're sick. You cannot go to work when you're feeling ill.
So,
Yeah, so truly we
before the
need to,
government of Uganda is putting much money, because we have seen it here in Uganda, in the sectors that it has where it puts much money, it is security.
exactly.
So it must not give
Only
a lot of funds to security. When the elected sector, it is not also considered in that same regard.
Well,
It must be
security,
elected first, then
security is also needed. Of course, security is needed, but I truly do believe that the fundamental for human life, the most fundamental sector for human life, is health. So I truly do believe that the number one, the sector that should be taking the biggest share on the national cake is the health sector. Then other things can come in at a later time.
Oh, so by summing it up, the way out of it is of increasing of government funds into health sector and even following up after funding in.
Exactly. So the government should be able to fund and again do the monitoring.
And another thing,
Yeah, exactly.
the president of this country, I think a year ago or perhaps 2 years back, I'm not certain, but he said and he recommended that all science teachers, they must be paid highly. That is promoting science. And if we are talking about science, that we may be considering even the doctors, the physician, they're called what?
Physicians.
Yeah, the physician. So I think even the president of this country knows it very well.
Yes, of course, he knows it and he acknowledges it, but we've not seen any efforts towards what he actually believes in.
So you think that
because I remember this was just
these
were just empty promises, because I remember at one time he promised to pay interns. It could have been 2.5 million, and then it was only one cohort of interns that received that salary. Then after that, their salary was again decreased 1M. So that shows you that, okay, we must first agree that he increased the salaries for science teachers, but that alone is not enough. You're giving salaries to science teachers, but laboratories are not well equipped. So how are you convincing me that exactly? How are you convincing me that you're putting priority to the health sector, to sciences, if at all there are no schools in villages? Maybe you could be knowing the countries, you could have grown up from the city, and you've seen maybe schools that have equipment, laboratories, and reagents that are needed. But we have schools deep in Mitoma, deep in Kalamoja, deep in Kotido, schools that do not have reagents, do not have science teachers. Students cannot offer biology at A level, and then we are talking about sciences. I truly do believe that that is partially a myth.
Okay. So, in your words, you're trying to say that these were empty promises of the president?
To a great extent, they were.
They were.
They were, because if at all they were not, then they should have made advances to actually effect whatever they said.
Oh, okay. So, Dr. Christon, we are going to be also talking about another issue here, and another issue, it is still in your sector. We have seen it, and it is much evident that malaria, it is increasing each and every year, and we have seen even the Ministry of Health giving mosquito nets to people, but still malaria, it has remained as a very big problem and a disease that is really affecting the people of Uganda.
Yes, please.
All the campaigns that have been done and have been held, what should, according to you, what is the main obstacle in order to achieve the main goal of making Uganda a country without malaria or less-free malaria?
Okay, thank you so much. Actually, malaria is one of the leading causes of deaths in Uganda.
Wow.
And
hold on.
Yes,
malaria, it is one of the leading.
Yeah, it's one of the leading causes of death.
leading
in
causes of
Uganda.
death in Uganda, malaria.
Exactly. Most especially to people under the age, to children under the age of 5 years. So that shows you the burden that we truly do have as a nation. But we must appreciate that this is something that can be done away with. We can eliminate malaria out of Uganda. So back to the question, the biggest obstacles that we have in elimination of malaria in Uganda, one, uh, uh, uh,
It is
the country has the government has made efforts, but I must say that the people are non-compliant to a greater extent, because when you look at the preventive measures for malaria, we have maybe you can talk of giving people mosquito nets,
treated mosquito nets,
slashing bushes around homes, draining stagnant water. But it's one role it's a role of the government to give out nets, and then it's a role of the people to sleep under mosquito nets.
Yeah, because the government
exactly.
It won't be there in their homes to monitor.
So if at all the Prime Minister launches a program of distributing mosquito nets, and they give me a net,
and then they have given out,
and they have given out, and then I don't sleep in a net. Don't you think that is my biggest problem?
It is the biggest problem, but I think even the government must also find the way out for that by creating awareness. Do you think that maybe it has been given out, but is not putting that awareness to people that they must sleep under mosquito nets?
Actually, what the government needs to do is actually do enough sensitization, not only give funding and maybe mosquito nets, do the sensitization of the people. Tell them that this is actually a killer disease.
It is at your own benefit.
It is at your own benefit. Recently, the government started a program to give malaria vaccination. So that is something that has to be effected, because when you look at countries like maybe the UK, America, those people are doing away with malaria. They do not actually have malaria in their countries, and they've taken enough efforts to eliminate the malaria. So that shows you that it's something that we can eliminate, and it is something that we can actually do and achieve.
So I think the main thing that we are supposed to do
is sensitize the people and tell the people that this is a situation that can be dealt with. But on the other hand, we also must appreciate that there isn't enough funding for such programs, because you truly do. I hope you're aware that the biggest funding that the country has been injecting in the health sector has been, in the form of donations.
Yes.
So the government has to find its internal funding to ensure that we can do things on our very own.
Okay, thank you so much for that information. I didn't know that malaria is one of the leading
causes. So the government
causes of death.
To take extra efforts to do the funding, do the implementation of the programs, and actually do the sensitization of the people, and actually effect the treatment of all the infected people, ensure that the drugs are there, ensure that the health workers are paid, ensure that everything is up to the standard.
Wow.
Yes.
Thank you so much, Dr. Kristen, with what you have told to us, with providing information and knowledge. In fact, I have been so green about something that you have mentioned here,
and it's our greatest honor to
I'm so well informed and knowledgeable about the thing that you have really put out.
It's my greatest honor.
Thank you so much. We are likely to welcome you again and even to host you. And the next time when we are going to have you, we will be talking about mental health. It is a bigger problem to the youth of this country today. And still we are going to be talking about the drug abuse, and even to talk about another thing. Recently, we saw USA pulling out its aid to Uganda through its agents of USAID. And this agency, it has been helping and giving free ARVs to Uganda. And we know Uganda is a poor country, and we know how costly it is to make or to manufacture the ARVs.
Yes, please. It's something that is very
costly.
Needs expertise,
So
knowledge.
we as Uganda, we may not be in full capacity to fund that project or to fund such
projects
yes,
on our own.
Yes, at our own. Now, the USA that has been helping us, it has withdrawn. So you will be talking about more of that and giving a way forward, and even not forgetting also to create awareness to the people of Uganda on how to protect themselves from HIV.
It will be my greatest pleasure to be hosted again on the Order Paper 256.
So thank you so much. We are so happy, we are so delighted to have you, and we are so honored to have you on this platform. We told you that on this platform, the Order Paper 256, it is a political, social, and economical platform of where we are going to be hosting people who are knowledgeable, who are expertise on what they are talking about. On the side of politics, we have been having lawyers. On the finance side, we are going to be having auditors. We are going to be having people who are financially independent. And on the health sector, we have been now having a doctor. With those few remarks, I would like to conclude the show by saying that like, subscribe, share to each and everyone, and always keep watching the Order Paper on YouTube, Order Paper 256 on TikTok. Analyst Marcos, your host. Thank you so much. Bye. Tutujimaze.